Hi everyone, welcome back. I'm excited to introduce this very special guest, Dr. Staci Eisenberg, who is the faculty director of the Visual Arts and Healthcare program at Brigham and Women's Hospital. Welcome, Staci.
Thank you. Great. Thanks so much for having me. I'm so happy to be here.
So for the audience members, if you can just introduce a little bit about yourself.
Sure. So I'm a med-peds trained primary care doctor. In addition to seeing patients of all ages, I work closely with the residents, both in med-peds and also in internal medicine at the Brigham. I'm originally from Southern California, and I did my training here in Boston. Not surprised, yeah. I had that vibe. And I did my training here in Boston, actually at sort of an earlier iteration of the current program I work with. So I did my internal medicine training at the Brigham, so go back a long time. And then my pediatrics training both at Children's and Mass General. And I've actually lived in many wonderful art cities over the course of my life in Los Angeles, Chicago, Boston, and New York City. And outside of work, I'm a mom of 2 kids and have a wonderful supportive husband. And like many people, we love to travel, going to see new places, meeting new people, trying local cuisine.
That's amazing. That's amazing.
That's a brief little bit.
Yeah, and I mean, you just mentioned so many different cities that you've lived in. Is there a favorite?
Oh gosh. Am I allowed to say something other than Boston?
Yeah.
I love it. So New York City is amazing, but it's also can be a hard place to live and expensive. Chicago actually, I think is such a special place. I have no strong connections of what would be a place, but there's so much wonderful culture there. The theater is fantastic. The museums. I think it's a reasonably sort of affordable place to live and be connected to the city. So I have a soft spot in my heart for Chicago.
Okay, Chicago it is.
Yeah.
So we're obviously here today because you are the new faculty director of the Visual Arts and Healthcare program. So congratulations, first off.
Thank you. I'm so excited.
Yeah, and so I just wanted to maybe first talk about the field of art and medicine, and maybe a little backstory into how you yourself got into that particular intersection.
It's a good question, and I think my path may be interesting compared to some. So I really came at it actually from an interest in medical humanities and resident education is kind of how I came into it. And so I grew up going to, as I mentioned, museums and theater. And I actually was an English literature major in college. So a big part of what was compelling to me about medicine and why I came to the field was really this idea of sort of the human aspects of medicine. So that really led me to my role in resident well-being in internal medicine. So in addition to being an assistant program director in med-peds, I'm an assistant program director for resident well-being in the internal medicine program. And through that program, I started doing the visual arts and healthcare programs for the intern humanistic curriculum with Brooke. And basically my kids can tell you that those sessions, we do one for each group, and those sessions are really just one of the highlights of my year. We do them in the sort of fall and early winter, and I sort of fell in love with that. I found it so rewarding and so meaningful. And so from there, every chance I got, when Brooke would reach out to me to do other work in the area, I always said yes, and I've continued to get more involved.
Yeah, so I guess a little transition from that. How did you come to apply to this position?
So as I mentioned, ever since I got first connected to the programming, the visual arts and healthcare programming, every chance I've had, I've said yes to get more involved. And there's a couple specific reasons why I was interested in really this more sort of program level position. So the first one is I'm really excited to engage with a broader cross-section of people. So over the course of my career, I've done a lot of work with different areas of medical training, so both undergraduate or medical students as well. But the last couple of years, I've really been more involved with resident education. So I'm super excited to get back involved more with medical students and also to think about working in this space with physicians as well as lots of other folks in the healthcare team, so nurses and advanced practice practitioners. So I'm super excited to get to kind of re-expand my horizons and who I get to work with and doing it in an area that I really feel passionately about. So along those lines, another part of this work that has been so enriching for me is the other folks sort of medicine adjacent, because they're people who are from the arts education field, but are so also passionate about this work we're doing And so Brooke, of course, is a huge reason why I applied. And I love working with Brooke, and any chance I get, as I said, to work with Brooke, but also a lot of the other art educators. They're just really incredible, amazing people who, again, share a passion for a lot of the work that we're doing and are so invested in the idea of medicine and helping us be, better healthcare practitioners. And they're just really cool, fun, interesting people to hang out with. And so that piece of it has really been so enriching for me. Also, I mentioned I love working with Brooke, and Joel Katz, who helped found the program, is a long time beloved mentor and role model of mine. So anything that basically means I get to learn from and keep working with Joel is a huge thing. And the last one is also connected, and it's just, I talked about this, sort of alluded to, but I think about in my role with resident well-being a lot about the idea of finding joy in work. I think it's so important that we're finding joy and meaning in the work that we're doing, and not just sort of outside of work is where people kind of think of their well-being. And so this program for me, or doing this work, is one of the things that brings me joy and sustains me. And so the chance to get more involved with that and find more ways to be doing that was sort of a no-brainer. So, and I'm so excited to think about that and share it with more people.
Yeah, that's awesome. And, not just residents, but honestly, anyone who's working, it's very easy to fall into a routine.
Yes.
And going through the same motions every day. So, changing it up, being mindful of, your own well-being, that's really important.
Yeah, exactly. So I think where I've started thinking about this so much more, because sometimes I'll talk with residents or even other physicians about sort of I've been in some sessions where we sort of do roses and buds and thorns, and so often what people talk about, that's what they're looking forward to, or what makes them happy, are things outside the hospital. And I totally get that. As I said, I love to travel. But I want to think about how can we find more ways to think about what those moments are in our work, because we spend a lot of time at work, and there's a lot of investment in the work that we do. So exactly.
Yeah.
Not surprising. You totally get it.
There's got to be something more than having a golden weekend.
Exactly. Yeah. And not to diminish that that's so important, but really, exactly, finding those moments of joy at work.
Yeah. Absolutely. So a little bit back to more so about the visual arts and healthcare program. Where do you what events, programs do you hope to see the program do in the future?
Well, that's hard because there's so much I want to do, and also I want to make sure that I'm talking to Brooke and figuring out together on our board of directors what everyone wants to do. So I feel like I'm just part of this wonderful larger team. So, but some things that I have been thinking about, and are the things that I talked about when I interviewed for the position, there's a couple that are on my mind. So again, one of the things that I sort of alluded to and why I have loved this programming is working with lots of different people and wanting to work with more people. So definitely the idea of bringing people together, particularly from different disciplines, whether it's different specialties or across the healthcare team. And I think it's both really important for sort of interpersonal connectedness, just getting to meet and connect with people who share our values. But I also think it actually has a lot of potential impact on workplace morale. And I'll give you an example. So I think sometimes, if you can imagine being on one team and maybe consulting another specialty, and because we're all, as you sort of alluded to, working really, really hard and really busy and sometimes stressed, we don't always all bring our best selves to those interactions. But if you imagine that you're consulting someone who you did one of these visual arts and healthcare programs with, and now that's someone you haven't really, even though these programs, sometimes they're brief, but the connections can be so powerful, that completely changes that interaction. So that's one of the things I'd love to do, is find more ways. A lot of these programs, I think, there's some great interdisciplinary programs like the ITU one that bring teams together, but I'd love to think about how we bring physicians or other healthcare providers across the hospital together for some programs. So that's one thing. I'm also really interested in the idea of professional identity formation. Sort of what does it mean to be a physician or another role in the healthcare team? How do we think about what that means? And so I'd love to be more intentional about how I think some of our programs are already really tied to that, but I'd love to be more intentional about that. And I think that's particularly relevant for trainees, but it's also really relevant for people who finish our training to kind of take a step back and think about what does it mean to me to be a physician or a nurse or these different things, and how do I show up as that, and how can we be intentional about that in some of our programming. And the last one is that something I'm really excited about is a lot of our programs are, I think, appropriately focused on physician well-being or physician skill sets. And we know that engaging in visual arts programming is really helpful for physicians for a lot of ways. Again, I think some programs focus more on skill building, like VTS is really a lot about observation or communication. And then some other parts are more reflection, and a lot of our programs bring those together. There's a whole separate set of literature on how impactful visual arts is for patients, right? And there's the really cool the Mass Cultural Prescription Program. So we know, and I think there's this really exciting opportunity to bring those together. So I think the idea of bringing patients and providers together for a program it would be really, really, and that is
about bringing
right. Wouldn't that
barriers,
be cool?
right?
I think it would just be so powerful. And again, it almost goes back to the idea of, the idea of like the doctor-patient relationship, or so much we know. A lot, I think, of what contributes to things like burnout are the tasks that we have that are not connected to interacting with patients. And I think for patients, there's frustration. And if we could bring people together in these kinds of programs, I think it could be so meaningful and so powerful. So that's my kind of pie in the sky aspirational one.
That's incredible, and I think we all are very excited to see you in this new position and to see what you bring to this program. I think it's safe to say that we're very excited for the next steps.
Well, thank you, because I am so excited, and I'm really looking forward to working with so many different people, including you.
Well, thank you so much for taking the time today. It flew by, but yeah.
Yeah.
Thank you.
Thank you so much.